All right, everyone, welcome. And we are about to begin at this moment.
Good evening, everyone. Good evening. Thank you for joining us this evening. I am Dr. Nitria McNulty, and I will serve as your moderator. I am a proud member of Zeta Phi Beta Sorority Incorporated, and I am the chaplain of the Kappa Zeta chapter of Dallas County, and I'm excited to be here. We would like to start this webinar off by recognizing our five beautiful founders who sought to forge a new path of scholarship, sisterhood, and service. Our 26th International President and CEO, Dr. NC Grant, that continues that legacy with her platform focused on the extraordinary power of she. Miss Retta Washington McCoy empowers the Southern region to embrace the extraordinary through her leadership. And our West Texas State Director, Miss Latanya Logan, leads by example and impresses upon us to value intentional leadership and impact. As a leader and mentor, Miss Cornelia Hicks leads the Kappa Zeta chapter of Dallas County with poise and zeal as the 2025-27 chapter president. Mrs. Christian Lloyd, chair of our Stork's Nest Charity Fund of Dallas, which you will hear from her later. And that's me. And our speaker for this evening, I am happy to introduce you to Miss Queen Equibina. She is a licensed professional therapist, counselor, with an expertise in trauma-informed cultural response therapy. She is a children's book author, and tonight she's here to talk to us about wellness and Black maternal health. Queen, are you ready to get started?
I am ready. Thank you. Okay. Again, my name is Queen Akabina. Happy to be here and give you guys some great information. And I appreciate you being here. Before we even get into the content, I just want to start with a simple question for you to think about. When you hear the phrase maternal health, what comes to mind for you? Most people think about pregnancy, maybe labor and delivery, maybe complications during birth. But what we're going to talk about today goes much deeper than that. This presentation is going to focus on Black maternal health in Texas. But the themes we're going to discuss are not limited to just Texas. They reflect broader patterns in healthcare systems across the United States. And I want to frame this conversation in a really specific way. This is not just about outcomes or statistics, it's about experience. It's about what it feels like to navigate healthcare during one of the most vulnerable times in someone's life. And throughout this, I just want us to keep one idea in mind. Maternal health should not just be about survival. It should include safety and dignity and autonomy and the ability to experience joy. Next slide. When we talk about Black maternal health, it's important to understand that this is not just a clinical issue. Um, it's it's a public health issue, a mental health issue, and a social justice issue. The outcomes we see are shaped by healthcare systems, structural inequalities, and lived experiences. One of the most important points I want to emphasize is that many maternal deaths are preventable. And when something is preventable, that tells us something very important. It tells us that there were missed opportunities, moments where intervention could have made a difference. So, this is not about blaming individuals, it's about asking, where did the system fall short? Was a symptom dismissed? Was care delayed? Was follow up inadequate? And another piece I want to center is something that usually gets left out of these conversations, and that's joy. We talk a lot about risk and complications and mortality, but maternal health should also include the ability to feel safe and respected and supported. It should definitely include joy. And when that is missing, that's also part of the problem. Next slide. Nationally, Black women in the United States are about 3 times more likely to die from pregnancy-related causes compared to white women. And I want to pause on that because that's huge. That's a big deal. Because what's especially important in this disparity exists regardless of income or education or insurance status. So it's not just about access to care. This tells us that even when access is similar, outcomes are still different. And that points to differences in the quality of care, how concerns are addressed, and how quickly interventions happen. This is where we begin to see the role of systemic factors. And it challenges us to think differently. Because if this were purely about access or behavior, then we would expect those disparities to decrease as income or education increases, but they don't. And that's what makes the issue so important to understand. Next slide. Okay. When we look at Texas specifically, we see these disparities reflected very clearly. Black women experience higher maternal mortality rates. And again, many of these deaths are considered preventable. Okay, which means there are points where different actions could have led to different outcomes. One of the biggest areas of concern is the postpartum period. Many complications occur after the hospital discharge. Okay. And during that time, follow-up care may be inconsistent. So even though a patient may leave the hospital appearing stable, that doesn't mean they're no longer at risk. Okay. And this is where the gap in care can become especially dangerous. Okay. Next slide. All right, now this slide highlights just how disproportionate the impact is. In some analysis, Black women account for about 73% of maternal deaths, while representing about 43% of births. That's a significant difference right there. And it's not something that can be explained by individual risk factors alone. It reflects systemic inequalities, care is delivered and experienced. So when we see numbers like this, it forces us to ask deeper questions. Okay, not just what happened, but why did this happen? Okay, next slide. So to understand why these disparities exist, we have to look beyond individual behaviors and look at the systems. Maternal health outcomes are shaped by structural factors, things like housing, transportation, income stability, and access to safe environments all play a role. Okay. There are also differences in healthcare systems, including variability in hospital quality and provider practices. Okay, so even something as basic as getting to an appointment can be a barrier for some people. And if someone is unable to consistently access care, that affects their outcome. So when we talk about improving maternal health, we have to look at the bigger picture, not just what happens in a clinic or a hospital. Next slide. All right. Chronic stress, that's another major factor. And this is not just emotional, it has biological effects. So, long term exposures to stress can affect the cardiovascular system, it's your heart, your immune function, and just overall health. So, this concept is sometimes what we call weathering. Um, it describes how the body carries the cumulative impact of stress over time. Okay. And when that stress is tied to systemic inequalities, it increases the risk of complications during pregnancy. So, maternal health is not just about what happens during pregnancy, it's also about what happens before pregnancy over the course of someone's life. Think about that. Next slide. Okay. This is one of the most critical areas to understand. Bias in healthcare can influence how symptoms are interpreted and how quickly care is provided. Sometimes people's concerns are dismissed or they're minimized. Um, Pain may not be taken as seriously. We see that a lot. Or there may be delays in escalating care. We see that a lot too. And all those delays, things like that, really matter because in many cases, early recognition and treatment can prevent complications later on. But bias doesn't have to be intentional to be harmful. And that's what I think some people don't understand. It could be subtle. It can show up in how someone is spoken to, how quickly they're believed, or how their symptoms are prioritized. But over time, those differences add up and they do have serious consequences. Next slide. When we shift to mental health, we see another major gap. Okay, research shows that between about 69 69 to 86% of Black women experiencing perinatal depression, peri means before depression, they don't receive treatment. And that's a really important number to sit with. That's big because that tells us that a large portion of people who are experiencing symptoms are not getting the support that they need. And it's not just about access. Even when someone is connected to healthcare, mental health concerns may not be identified. Um, they may not be taken seriously, or they may not be followed up on. There are multiple reasons for stuff like that too. That can include underdiagnosis, misdiagnosis, and limited access to providers who are culturally responsive. So being in care doesn't always mean that care is meeting all of the person's needs. Okay. Next slide. Okay, so when we look more closely at why these gaps exist, we can see that it's happening at multiple levels, right? And at the provider level, it it can improve awareness, knowledge, confidence in recognizing symptoms. But training alone is not enough. People get trained all the time. It's not enough. Even after training, implicit bias can still be present. So that's because bias is not just about knowledge, it's also about patterns and experiences and systems. Okay. So that tells us that one-time interventions are not sufficient. We need ongoing education, reflection, accountability, system level change. So, because without all that, then the same patterns can continue even with good intentions. Next slide. All right. Perinatal mental health includes a wide range of conditions. So this can include depression, and anxiety, PTSD, birth trauma. We see that a lot. Something happened in a previous birth, that grief also, um, And grief can show up in different ways, including pregnancy loss or infertility journeys. One of the challenges is that many of these experiences are actually normalized. Okay. People may be told that what they're feeling is just part of being a new parent. A lot of people get dismissed. You have to listen to your body, you have to listen to folks. But telling them that that's just part of being a new parent, that can lead to symptoms that end up being overlooked or just dismissed. So it's important to recognize that mental health is not separate from maternal health. It's a core component of safety and just overall well-being. Okay, next slide. All right. When mental health concerns are not addressed early, they usually don't stay the same. They get worse as time goes on. Depression can become more and more severe. Anxiety can escalate into panic attacks, intrusive thoughts. Um, and in some cases, that can lead to crisis level care, emergency room visits, hospitalizations, things like that, which only then increase someone's trauma. Um, Beyond that, there are broader impacts. It can affect daily functioning, the ability for somebody to take care of themselves or to bond with their baby. It also impacts the entire family. You know, when someone's going through something like that, it's not just them, the people around them are affected. Other people have to step in. People don't typically understand what's going on. So, early intervention is not just something that's helpful, it's actually preventative care. Um, Addressing mental health early can improve outcomes, not just for the mother, but for the child and the whole family as well. Next slide. Okay. One of the most important and powerful tools that we have in healthcare is listening. Can't tell you how many times people will say to me that, you know, they've seen someone before and they just felt like they weren't listening to them. And even with doctors, you know, they're busy and they're typically going from one patient to the next. People don't feel like they're being heard. There's this campaign in Texas that says if something feels wrong, it deserves attention. And that might sound simple, but it's actually critical because patients usually recognize when something is not right before it becomes clinically obvious. Okay. So listening isn't just about communication, it's a safety intervention. It allows for early recognition of symptoms and then earlier response. And then it also builds trust, you know, which is essential for effective care. If someone feels like you're taking them seriously when they say something, they're more likely to tell you when something's wrong because they know you're going to do something about it or research and see what's going on with them. They're not going to feel like they're dismissed. So why even bother saying anything in the first place? Next slide. These are warning signs that should never be ignored. Okay, symptoms like severe headache, chest pain, difficulty breathing, vision changes, swelling, those are all things that can indicate serious complications. These could be signs of conditions like preeclampsia, hemorrhage, or other cardiac issues, and those conditions can progress really quickly. Okay. So the key message here is that these symptoms require immediate medical attention. Okay. They're not something to wait on or try to manage at home. A lot of times, particularly a lot of women have these kind of symptoms, preeclampsia, and people always think, well, I'm just tired, I should sleep, go to sleep. You go to sleep, you may not wake up. So you feel something like that, you need to go to a hospital. I had preeclampsia with my daughter. I actually was a person who did try to sleep it off for a little bit. I took my blood pressure, it was really high. I thought, okay, well, I'm just tired. It was a long day. Went to sleep, woke up, it was really high again. And I called the hospital and I said, I'm pretty sure I have preeclampsia. I'm coming in. You know, so it's not something you want to waste time on. Next slide, please. Okay. Mental health warning signs are just as important. These are things like thoughts of self-harm, severe anxiety, persistent sadness, difficulty sleeping, feeling disconnected. those are all medical concerns. They're not signs of weakness, nothing like that, and they definitely deserve the same level of urgency and care as physical symptoms. And recognizing those signs early, responding appropriately can make a significant difference in outcomes. Okay, next slide. Okay. So this brings us to that concept of reproductive justice. Reproductive justice focuses on the right to a safe pregnancy, respectful care, bodily autonomy, and the ability to raise children in safe environments. Okay. It expands on the conversation beyond just healthcare access. It's about people's dignity, respect, and just the conditions that people are living in. Um, and this it shifts the focus from just surviving pregnancy to actually thriving during and after it. So this framework helps us think more broadly about what true equity in maternal health looks like. Okay, next slide. All right. Good news is that we do know what improves the outcomes. Standardized care protocols can reduce variability in how care is delivered. Um, Early and consistent screening can help identify uh, concern before they escalate. Culturally responsive care can also improve trust and communication between patients and their providers. Community-based supports like doulas and peer support have also been shown to improve outcomes. Okay. And then ongoing provider education helps to ensure that care continues to improve over time. So the issue is not that we don't know what works. The issue is making sure that these strategies are implemented consistently and equitably. Next slide. Okay. Improving maternal health outcomes requires action at multiple levels. So for providers, that's going to include listening to patients. I can't emphasize that enough. Listening to patients, validating concerns, taking symptoms seriously, ensuring appropriate follow-up. It also includes recognizing and addressing bias. Um, for families and support systems, it means checking in on each other, not just checking in on the mother, I should say, not just the baby. People do that a lot. How's the baby? What's going on? And we're not even thinking about the mom. See how mom's doing. It's a lot. Um, it means encouraging, help seeking, and advocating when concerns are dismissed. I saw something that talked about how when someone's really going through um, a crisis or something in the hospital, have doctors saying stuff. There's all this information that's being thrown at them. They're not really in a good state to make a decision then. So they need people. That's where family support comes in to advocate for them and step in and speak on their behalf, because that, with what on top of what they're going through, is just so much. So it's really important to have people who are also advocating for you so that your concerns are not getting dismissed. And then at the community level, this includes promoting awareness, supporting equitable policies, and centering the experiences of Black women. So this is not something that one group can solve alone. It requires a shared effort. Okay, next slide. All right. All right, for this one, I want to start by normalizing something here. Pregnancy is usually framed as a purely joyful experience. But for a lot of people, it's a mix of emotions. There can be excitement, but there's also stress, anxiety, and overwhelm, especially with everything happening in life at the same time. So for Black women in particular, there can be added layers to this, like navigating healthcare systems, dealing with stress, feeling pressured to stay strong. Okay, so mental health during pregnancy isn't automatic. It's something that needs support, attention, and space. Okay, next slide. There are real barriers that make it harder to maintain mental wellness during pregnancy. One is the stigma, feeling like you shouldn't need help or shouldn't talk about how you're feeling. Another is access. Not everyone has access to providers who understand their experiences or provide culturally responsive care. And some people don't know that they can shop around. I didn't know that before, too. I thought whatever doctor I have, okay, they know best, and I stuck here. But then life happened, and I learned quickly if this one doctor is not listening to me, I said, thank you for your time, and went search for a different doctor. And so I had someone who I felt was on the same page with me. So you can do that. You don't have to stick with whatever doctor that you just get then. Okay. Um, then there's this pressure to push through, to take care of everybody else, and to not prioritize yourself. So when we talk about mental health, we also have to talk about what gets in the way. Okay. Next slide. All right. So when we say joy, we're not talking about everything being perfect or easy, because it's not. At least not for a lot of people. Joy is about feeling supported, feeling safe, and having moments where you can actually breathe and feel at peace. It's about being seen and cared for, not just medically, but emotionally. And for Black maternal health, centering joy is powerful because historically, this hasn't always been prioritized, right? So joy becomes part of healing, not something extra. Okay, next slide. All right. So now let's talk about what actually helps. Mental health during pregnancy is supported by small, consistent practices, not perfection, don't have to be perfect. That can look like having a routine, just making time for rest, having safe ways to express what you're feeling, whether that's therapy. I'm always an advocate for therapy. It could be journaling, or just talking to somebody that you trust. Things like breathing exercises, gentle movement. You could literally just say, you know what, I'm going to walk around for just 5, 10 minutes and come sit. Just move, walk to the next room, anything. Listen to music, mindfulness. Those are all things that can help regulate stress. And most importantly, getting support early, not waiting until things feel overwhelming. Okay. Next slide. These are simple, everyday things that can make a big difference over time. Setting boundaries. A lot of people have problems doing that. Set those boundaries. Say no when you need to. Reducing stress where you can, even in small ways. Staying connected to people who feel supportive, people who feel safe for you. And checking in with yourself regularly. Just asking, okay, well, how am I doing today? That's something that I do almost every morning. Literally take 30 seconds. What am I feeling right now? Anything am I feeling stressful? Any tension anywhere? And you work that out. Okay. That awareness is usually the first step to getting support that you need. Next slide. All right. So nobody is meant to go through pregnancy alone. Okay. Support can come from partners, from family, friends, providers, or community. But the key is not just having people around, is having people who listen, people who validate, and who take you seriously. Okay. So when somebody feels supported, it's going to reduce their stress and promote and improve both the mental and physical outcomes for them. It also makes it easier to speak up when someone doesn't feel right. Okay. Next slide. One of the biggest gaps we see is that mental health is usually addressed after a problem shows up instead of preparing ahead of time. So this is about thinking proactively. Who will support you after birth? What will rest look like for you? What will help look like for you? And also just being really aware of the early signs of postpartum depression or anxiety so that you can recognize them sooner. Preparation doesn't prevent everything, but it makes a big difference in how supported someone feels. Okay. Next slide. All right. So I want to end this section by just reframing how we think about maternal health. It's not just about avoiding complications or preventing death. It's about whether someone feels supported, respected, and yes, able to experience joy. Joy is not a luxury. Okay, it's part of what good, equitable care should support. All right. And that's what we should be working towards. All right. Next slide. All right. So I also want to end here by reframing how we think about this topic, right? Black maternal health is not just about preventing death. Um, Again, ensuring that safety, respect, mental well being, the ability to experience joy in motherhood. Um, and when we think about improving outcomes, we have to think about the full experience, right? Not just the absence of complications, because that's what quality care should look like. Okay, next slide. That is all I have.
Thank you, Queen. I really appreciate all of this. I don't know if you could see me in your camera, but it was amazing. And I was just like, wow, those are some amazing facts that you shared. And I appreciate you sharing about well-being. And one of the things that stuck out for me is that maternal health and mental health, they're not separate. And sometimes we often treat them as separate things, but they're not separate. You have to address those together, whether it's pre, during, and post. And if we can do that, we can really help shape um, a better experience for mothers. And so, if there's anyone that would like to drop questions in the chat for Queen, please do. One question for me that popped up is as we talk about that support system and those advocates, um, and I know we talk about grief and loss with Black maternal health. What are ways that I guess the partner, the spouses can help with supporting that loss because they're also experiencing that grief as well?
And this is going to look different for everyone, right? Like people process grief differently. So what works for one person may not work for another person, and that's perfectly fine. But it all starts with really just listening, asking. I've been through my share of grief, and a lot of times people never really knew what to say to me, and sometimes it's really just sitting there, or even just asking, can I just sit here with you? Or don't ask a question. You could just be like, I'm thinking about you. If you need something, I'm here. Because a lot of times people going through grief do not know what they need in that moment. You know,
Exactly.
we
Exactly.
just, or
Exactly.
I might think I want this now, and tomorrow I want something different. So that communication is also going to be really important there. And you're right that both partners are experiencing that, and they're experiencing it in different ways. So communicating with each other. Support groups are really, really helpful for me. I know a lot of people who have said the same, and some people feel like groups aren't for them. The
Hmm.
thing that I would say, at least try it out. You do not have to share anything if you don't want to. You can just be there and listen. And
Exactly.
when you feel comfortable, then you can share your piece, but you don't have to say anything. But it's good to, I think it's helpful for a lot of people to just know that the things that they're feeling, thoughts they have, they're not alone in that. Because a lot of times that's what people think. People feel like I'm crazy for thinking this, what's happening, but it's like, no, other people. So then they feel, okay, so this is okay. This is all right that I feel this way, and I think it also helps to see people who are further out in their grief. I know that
Hmm.
for me, first time going to support group and there are people laughing and talking. I thought these people are crazy. How is it that they've had loss and they're sitting here laughing? Like this is,
Right.
I,
Right.
I couldn't believe it, But I mean, it shows you it's not as raw as it doesn't stay that raw forever.
Right.
So
Right.
that's something I think is helpful with that. Yeah.
And there are groups for both women and men. There are
Yes.
groups for all partners. So don't feel like you have just because you didn't experience the loss physically that there's not a group out there. And there are virtual groups, there are Facebook groups, there are all types of things out there for people. So make sure that it's a healthy group. We do have a chat, and this is a chat from this is a question from the chat. What are some questions that what are some ways that we can actively advance social justice? You talked about that reproductive justice, which is a great word. I love that thought. Um, through our advocacy efforts, what are some ways that you would suggest or you have worked with? What do you have for us?
And
It's a
that's an
loaded question, isn't it?
Yes, yes. It's because you want to throw out all these different things and people can't do everything, but um when we talk about advancing social justice, especially when you throw in like that reproductive justice lens into it, it comes down to, I would say, moving from awareness into intentional action. So that action it doesn't have to be a big, something meaningful, whatever. It just has to be consistent and it just has to be something that's grounded. So one of the biggest ways is through advocacy and just everyday spaces. So that could look like speaking up in medical settings,
Okay.
challenging dismissive language. I've been there in a waiting room and I've seen something. I'm like, hey, that doesn't look right, So speaking up when you see something. Like, hey, this person's been sitting here for a while. She really needs help, those kind of things. That helps. Um, just making Black women's concerns actually heard, making things documented. And we're in an era now where so much gets put on social media. So we see these videos and things like that of people being in these settings. And so we know that these things are happening.
Hmm.
There's also power in supporting and amplifying organizations already doing that work,
Yeah,
whether that's like local Black-led maternal health groups, doulas are really, really good support, midwives or community-based programs. Sometimes advancing justice isn't about like reinventing anything. It could just be about resourcing what already exists, so that it can reach more people.
I love that. I love that. And I like how you said it's not about the awareness, but and one of the things you pointed out um in your presentation is that some of it is a lack of education. And so being aware is nice, but if we don't educate well in the right spaces, we are not doing ourselves justice, right? If we're not in the right communities, if we're not sharing it at the right time, if we're not promoting the right resources to the right people, then we're not giving it justice. We're not creating those equitable spaces.
Right.
So I love what you shared. And I thank you for your presentation. I know you'll hang out around with us a little bit longer. And so and again, I really thank you for your expertise. And if you all want to drop some more questions in the chat for her, she will be happy to answer those. Now I'm going to turn it over to Chairperson Lloyd.
Good evening. Thank you so much, Dr. McNulty. My name is Christian Lloyd, and I have the pleasure of serving as the board chair of Storks Nest Charity Fund of Dallas. For those who may not be familiar with our work, we are a 501c3 nonprofit based in the Dallas, North Central Texas area, and we are the charitable arm of Zeta Phi Beta Sorority Incorporated, the Kappa Zeta chapter. Our mission centers around supporting women and families by promoting healthy pregnancies, healthy children, and stronger communities. What we've heard today just reinforces our work and the reason why our work matters. The experiences shared, the data, and the real stories all point to the need for intentional care and access, advocacy, and supporting Black mothers, especially when it comes to mental health. Next slide. So what we do at Sparks and Charity Fund of Dallas, our work focuses on meeting that need in tangible ways. Through our Storks Nest Education Program, we provide prenatal education and support so women are informed and empowered through their pregnancy journey. We also invest in education and mentor through scholarship and programs to support young women as they grow into leaders of our communities. And through our community partners like Dallas Colleges, we continue to expand access to resources, including initiatives like our Lactation Nest program at 6 of the 7 Dallas colleges. This webinar, Rooted in Justice, Rising in Joy, reflects the kind of collaboration that is needed to move our work forward. And we're proud to stand alongside Zeta Phi Beta Sorority Incorporated, Kappa Zeta chapter in this effort. Of course, as I close, I invite you to stay connected with our programs, our upcoming events, and ways to get involved by visiting our website, which is www.sncfd.org. Whether you're looking to support, partner, stay informed. We welcome you to join alongside us in the fight as we put a dent in the disparities of our communities, and we promote supporting women and families by creating healthy pregnancy environments and advocating for healthy children and stronger communities. Thank you so much.
Thank you, Mrs. Lloyd. We appreciate you sharing more information. And if anyone needs more information, please drop your questions in the chat and we'll be happy to answer those. And I'm going to now turn it over to Mrs. Carrie Donaldson to share more information with you.
Thank you, Dr. McNulty. I'm Carrie Donaldson, the chairperson of the March of Dimes Committee for the Kappa Zeta chapter of Zeta Phi Beta Sorority Incorporated. I want to thank you guys for taking the time to be on this webinar tonight. Here are some additional maternal resources that are available within our community to assist mothers, their babies, and families. I'll give you some time to scan over the list here. Thank you. As you can see, there are several community resources available. Please take advantage of them. Most of them are partners that are willing to help in any way possible to help mothers in their pregnancy, during pregnancy, post-pregnancy. Now, a special thank you to my sword and a wonderful presenter, Queen Ekobena, for bringing this information to us and shining a light on the importance of this issue, especially during Black Maternal Health Week. And I'd like to thank Stork's Nest Charity Fund of Dallas for partnering with us tonight. I'd also like to thank Dr. McNulty for moderating and doing such a great job engaging us. And to the Kappa Zeta March of Dimes Committee, I say thank you very much for supporting this endeavor. Also to the Health and Wellness Committee, Kappa Zeta, thank you so much for all of your support. I'd like to thank Ms. Zaria Griggs for supporting us with the community resources. And to our amazing Kappa Zeta leadership, thank you for your support and for your encouragement throughout this process. And now for a few closing remarks, we have our Kappa Zeta chapter president, Ms. Cornelia Hicks.
Well, thank you, Madam March of Dimes Chair, for first of all, thanking everyone that's been involved with the process thus far. And I also wanted to offer up my thank yous as well. On behalf of the Kappa Zeta chapter of Zeta Phi Beta Sorority Incorporated and the Stork's Nest Charity Fund of Dallas, as you see, I sit on that board as well and share in the same sentiments as a Madam Board Chair. I want to say thank you for sharing this powerful evening with us. Your presence honors Black Maternal Health Week and the theme, Rooted in Justice, Rising in Joy. It calls for us to confront injustice while fiercely protecting the joy and the wellness of Black mothers and families. We have heard clear truths tonight about the mental health challenges that Black mothers face, and we've also heard strategies, resources, and hope for transforming their care and experiences. Our charge is now to carry this knowledge back to our homes, our workplaces, and chapters, and to keep advocating for systems where Black mothers are listened to, believed, and fully supported. Thank you again to our presenter, our chapter member, our esteemed chapter member, Queen Ekobena. Beautiful presentation. And thank you again to our moderator of the evening, Dr. Nitria McNulty, and each of you for your engagement and commitment. May we leave here rooted in justice, rising in joy, and determined to build a future where every Black mother can thrive in mind, body, and spirit. Thank you all.
Thank you all, and you all have a great evening.